Our main goal in patient relations here at Cedars-Sinai is to make things easier, not only for our patients, for our visitors, for our nursing staff. We do crisis interventions. We participate in the grievance process. We help patients when they come to the hospital for surgeries.
I'm able to manage up a patient's experience from the moment they walk into the organization and making it their story and being able to tailor their needs and provide the care that they need on a daily basis is very special.
The last 25 years, I have met, taken care of, and assisted a lot of patients. It brings such a warm feeling to my heart.
Since COVID-19, it's been a very interesting time. Our roles didn't change at all. We are providing the same assistance, the same services to our patients, to our donors, to our visitors. The only thing that it changed is that right now we have like a virtual patient relations department.
We've been fully functional at home as well as in the organization and helping our patients through. We're still there for them. We have great relationships with our patients.
I am very lucky that as a bilingual healthcare provider, I'm able to help also the Hispanic community. And with my nursing background, I'm able to also give them comfort about listening to somebody that sounds like them, somebody that's also a nurse and is familiar with the organization and is familiar with their plan of care and what's going to happen.
An elderly wife called me. Her husband is older and he's in the hospital, and she couldn't see him, and they've been married for 65 years, and this is the first time that she's not at the bedside. She was really, crying, very, very emotional. So I listened to her. I validated her concerns. I offered to have a social worker call her, a nurse call her, to just really cover and provide extra emotional support to reassure her. And then when he was able to open his eyes, we FaceTime through iPad. So she felt much better, and she called at the time of discharge. She called and she said how thankful she was that I facilitated and opened a lot of different angles for her to have that extra support.
So I had one patient who had COVID-19, in addition to he has a terminal diagnosis. And during this whole time, he was alone. And the nurses were amazing. They were at his bedside, and we were able to also FaceTime with his mom on a daily basis. However, we understood that he needed more. His mother also needed to be by his side, and that was how they healed as a unit. We were able to receive a compassionate care visit so the mother could see him and be with him. And it was such a special time because as she was FaceTiming him, she surprised him and she walked in and all of the nurses were cheering from the outside, and it was a glorious moment to reconnect them and reunite them and have them aligned so that they could actually be together. There wasn't a dry eye anywhere, and we were just so joyful to see them together and connecting. And we all connected through this. And I think that's what I have been most surprised about, that the community and the nursing relationships and, the organization, we've actually grown so much stronger. We've been able to adapt with our bandwidth and provide more. And you leave here fulfilled because you've actually done your best for someone else.